The Arizona Department of Health Services, Office of Children's Health is responsible for administering the Sensory Screening Program. The program maintains screening rules and guidelines, funds the training of trainers and screeners, obtains annual screening reporting from schools, and manages the loaning of sensory equipment. Each and every year, thousands of children in Arizona receive free hearing screening in schools, communities, and sometimes in their homes. The hearing screening program follows requirements outlined in state statute. It relies on the hundreds of trained screeners to screen and refer children to receive the services they need to treat and prevent hearing loss. Auditory health is an extremely important factor in a child's development. Undiagnosed and untreated hearing loss can impact a child's ability to communicate, read, succeed in school, and develop socially. We know that any delays in these critical developmental milestones can have lasting effects. Hearing screening can happen immediately after birth. The human auditory system is essentially fully developed at this point and can be screened reliably, making it possible for babies to receive immediate interventions, minimizing the risks of language delay or deprivation. However, CDC data tells us that cases of hearing loss double between birth and school age. We know that not all children will receive a hearing screening between birth and school entry, and that there are a number of reasons why a hearing loss could develop as a child grows. This is why screening at various grade levels is important. Regardless of the type or degree, undiagnosed and untreated hearing loss can have a significant long-term impact on a child's academic performance and social-emotional development. Identifying a hearing loss as early as possible allows for all interventions to be started when they have the greatest likelihood of long-term positive impact. That is where ADHS certified hearing screeners come in. ADHS certified hearing screeners, with the assistance of volunteers, are responsible for completing hearing screenings on children enrolled in a public, charter, accommodation, or private school, including children and youth with special health care needs. Participating in the development of the hearing screening program at a school. Providing referrals based on hearing screening results. Reserving audiological equipment through the ADHS Sensory Screening Equipment Loan Program. Volunteering at a school as a hearing screener. And supervising volunteers. Please note, screeners may not diagnose hearing, speech, or language concerns based on the results of a hearing screening. Volunteers are often utilized during screening events and can perform screenings under the supervision of an ADHS certified screener. Those who volunteer to help with hearing screening typically perform the following functions: initial pure tone screenings with an audiometer, assisting with setting up the room, directing and assisting children during the screening, sanitizing non-disposable items between screenings, escorting children to and from a holding space to a screening, other tasks as assigned by the hearing screener. They may not, however, conduct more complex screenings. Volunteers will receive some training in advance, especially if they are assisting with a pure tone screening. Because unaddressed hearing loss can dramatically limit a student's access to educational material, complicate interactions with teachers and peers, and limit overall educational engagement, it is vitally important to identify hearing loss early. Thank you so much for your role in making this happen.